The Daily Show's Jon Stewart taking on the death panel debate with the woman who sparked that heated interpretation of the bill, former Lieutenant Governor, New Yorker Betsy McCoy. But what does the bill really say? Well, let's bring in Democratic strategist Richard Goodstein and Republican strategist Doug Heye. Welcome, gentlemen. Let's look at a recent op-ed piece yesterday written in the Salt Lake Tribune, talking about just some of the misinformation that's out there. Myth number one, death panels will be incorporated in healthcare reform. The truth, death panels already exist in the healthcare system. The largest, most influential death panels are the insurance companies, medical review boards that, of course, determine life-saving surgeries, medicines, and therapies to cover or deny. Gentlemen, who's going to finally start speaking the truth? And let's just cut to the chase and get the riff-raff out of the way. You know, I'll toss that out to you, Richard.
Sure.
Where's the responsibility?
Well, what's in the bill, and we'll talk about what current law and provisions are. What's in the bill, it gives the seniors or people facing end of life the opportunity. It doesn't require them. It gives them the opportunity to get reimbursed by Medicare for counseling about the options facing them, what works, what doesn't, exactly the kind of thing.
And that has been a part of law for quite some time.
Absolutely. Well, I'm just saying that's what hasn't been part of law is that hasn't been reimbursable.
Right.
What this law would say is they're able to get reimbursed for that. And I might add that when Sarah Palin was governor, she had a living will day. When Rush Limbaugh was advertising on his radio station, he was pumping for this very thing, as was Newt Gingrich. The notion that a month ago, something that everybody thought was rational, people actually knowing what their choices were, has now been demonized, is absolutely absurd and doesn't say very good things about our politics.
And Doug, before I let you jump in, let's take a look at what Betsy McCoy said recently. Then I want to get your opinion.
Putting pressure on doctors to require patients to go through a consultation that's prescribed by the government and then penalize them. Wait a second. And then to penalize them if the patient or their family changes their mind about their living will in a moment of crisis.
Because
that's really wrong.
It would be really wrong if that was in any way what this said.
Doug, Jon Stewart's right. That's total hogwash.
Well, you know, Jon Stewart really is one of the trendsetters in American politics. We've seen not just on this issue, but on so many issues over, certainly the past election. This issue is really personal for me, Dr. Nancy. My brother and I put my mother in hospice care when she passed away in 1997. And these are very real concerns that families deal with.
Of course they are.
They deal with every day. But politically, this has become such a problem for the president.
But aren't you glad that you and your brother were able to make informed choices and have a sort of a sane process with all of this, which is what all of this is about?
There's no question about that.
So how are you then, as a good Republican, going to get the vitriol and the misinformation out of the discussion?
Well, I think part of the way that the misinformation has been out of discussion is that the president has decided to move on from this language because the president really wants legislation that he can sign. He needs something to declare victory on, and if this is an impediment to that, I think rightly the president has decided to get rid of it.
But, I understand what you're saying, but the Republicans haven't moved on. Let's take a look at what Republican leader Mr. Steele said over the weekend.
There's clearly an attempt by at least the House members to put in place a structure that causes concern for the American people's respective end-of-life decisions. I think that's a legitimate point. You don't have to call it death panels if you want to. You can call it a panel. I call it rationing.
Michael Steele, whether you call it rationing or not, irresponsible to not get the language out of the way.
Well, look, Michael Steele's my old boss and is a good friend, and I think he's been absolutely effective on this health care debate and driving the message for Republicans. It comes down to, what people call things. Labels matter, words matter, and, if people don't want to call these death panels, if they're out of the way, I think that, again, is a good thing for the president to try and move his legislation forward.
Richard?
Yeah, listen, I think the surfacing of this term death panels will be seen when the story is written about this legislation as a turning point, because I think it's so delegitimized the arguments that opponents of health care were making, because I think the notion was if they could twist what people thought was good, living wills, counseling, so people knew what their options were, into something as evil-sounding as death panels, with a straight face, and almost Michael Steele kind of laughing about it, the notion that that could be seen as a legitimate part of this debate when it is so illegitimate, I think will actually be seen, again, when we look back as a turning point, because I think the public will say, that's right, this was the party that opposed Social Security. This was the party that opposed Medicare in the 60s. I'm not sure that their heart is really with me. And I will say this to President Obama. He's got to hit back hard on this, because it's so far-fetched, this death panel notion, that to even let it be part of this debate that we're having now makes, if I'm a Republican, I say, geez, that was a little easy, because this is nuts, and it's part of the debate. I wonder what I could put out there that might actually have some merit. This doesn't.
Politically, the president made a real mistake in New Hampshire when he used the terms death panel. That gave real credence to it, and people who wanted to oppose it bought into that. It was a very big mistake for the president to even use the term. I think
you're right. The words matter and labels matter, and frankly, if we're going to be an informed republic, this is ridiculous now. We have to get these lightning rod words out of the way and get down to the core root of the problems, and let's deal with it rationally. If most of us play between the 40-yard lines, we have to let the fringe crazy people on both sides get out of the arena. It's crazy.